Hi, I'm Elizabeth Vincentelli, and I'm a contributor to the New York Times.
And I'm Peter Marks, theater critic of the Washington Post. Welcome to another episode of Marks and Vincentelli, a podcast that Elizabeth and I have created, and following in the great footsteps of the Three on the Aisle podcast that we did with the marvelous Terry Teachout. We honor him on each episode with our continuation of a dialogue with you and with each other about theater in America. And we are both, at this moment, a little overwhelmed, Elizabeth, with theater in America.
It's a good problem to have that we're having right now. We're in the middle of the crunch of openings for the end of the Broadway season. It's great. I mean, it's a great problem to have. And I'm glad we have it compared to the previous last 2 years, which clearly were not there. I've been feeling very optimistic about our industry lately.
Oh, just the sheer volume of stuff, of inventory would make you believe that we are in a very healthy business.
Yes.
I'm not sure that is the case. This is a wishful thinking business more than almost anything. And we should say that, Broadway is this month, April, crowding out a lot of other coverage, although I've made some trips out of town, both to D.C. and to Philadelphia to see things. And and Elizabeth and I have both seen some stuff off Broadway, which we'll talk about later. But keeping track of all this is, yes, people outside of the business, our business, say to me all the time, but this is good, right? You're having fun. And I want to say, yeah. But it's still, a tremendous amount of work to take the measure of what's going on at the moment.
Yes, I absolutely agree. My only regret is I wish I had the time and travel budget to see more shows around the country. So that's something that I would like to do more. But and I know we often hear from people, hey, why don't you cover more theater outside of New York? Well, I wish I could, honestly, but we are where we are. But one of the plans for this podcast is to talk more to people around the country. So please raise your hand or suggest people who are doing good jobs in your area and tell us, okay, well, you should talk to this artistic director. They're doing great things in fill in the blank state. Maybe
we could have a spot like Willard Scott did, with 100-year-old birthdays. We could do hey, there's a 100-year-old theater critic in Cheyenne, Wyoming. We're celebrating today. Something. I don't know. Something.
Yes. So, Sanders, we will have, now we're so organized. We're going to have show notes with links and our email address. So check it out and you can write to us. And of course, we're on Twitter. Where, by the way, I got a good chuckle out of your remark that our name was the one that nobody else would take, the name for the podcast. And we looked every time we came up with a good name for the podcast, it turned out it was already taken.
Yeah.
And so at least now we're sure, we're completely safe that nobody will take this one unless they're completely insane.
Totally. Well, bringing us back down to earth is today's guest. Today, we're talking specifically about an issue that everybody in the theater world and beyond cares about. Of course, that is the situation, the state of being of COVID, the protocols, and what we can expect now and in the future for the handling of this dread virus that keeps coming back. So our guest today is Blythe Adamson. For much of the past several months, Blythe, who is an infectious disease epidemiologist, both a practitioner and a professor, she's been engaged in what theater people might consider an absolutely sacred task, which is developing the protocols that can keep actors, crews, audiences as safe as possible from the seemingly endless waves of the novel coronavirus. She has a company, a very successful one, called Infectious Economics, And she's working at the present time, in addition to other aspects of the industries, entertainment and beyond, she's working with more than a dozen Broadway shows, including some of the most prominent on Broadway. And she's joining us today to talk about that work and to help us understand the current state of affairs on Broadway and beyond, and how we can continue to best protect ourselves to ensure that the shows can go on. So, welcome, Blythe. Thank you for being on Marks and Vincentelli. Maybe first, if you would give us a little bit of background on your work, on the company, and how you got into this really unusual specialty.
Oh, thank you for having me. I've spent my entire life really caring about pandemics, whether it was HIV or malaria, other sexually transmitted diseases, influenza, both in predicting when they're going to happen, when they're going to explode, and also what are the combinations of things that we can do to control them, to be able to live healthy, productive lives. And so, when COVID hit, I was called in as an emergency responder to the White House and FEMA, and served as the lead data scientist there. And when I came out, after several months of being on the task force, many different companies reached out to me asking for help. So theme parks around the world, professional sports leagues, all trying to figure out how can we operate and not just be, canceled every time a surge comes. And it was really my initial lessons from, the NBA opening in July of 2020, where we were learning, okay, these transmissions are not happening on the court. They're happening in the locker room. And so when I, coming back to New York City revitalization, and understanding in my own neighborhood how, the economic impact and unemployment with all of Broadway closed, I could see that if we could actually reopen Broadway, the economic impacts on the hospitality industry, restaurants, so many jobs are really dependent on this being open, that it would be a really worthwhile public service. So it was just a privilege to be able to bring lessons from these other industries and from, my career in caring about this, to be able to help things reopen.
And just to set the stage, Blythe, you started. You were the pioneer in this space way back last year when Passover was the first play back after Springsteen on Broadway, the first actual play. But you were consulting with the team on that show, and I remember watching you go through some of the game, playing actually gaming out the possible scenarios if one person tested positive, if it went through a company, if all the ways in which the cast and crew could protect themselves, and it grew from there. So you're now working with a whole bunch of shows. Is that right?
Yes, yeah. We really had to scale this. I mean, when it was just one show, it could just be a few of us, but now we have an army of trained COVID safety managers, at theaters across the city and across the country. There are infectious economics also supporting tours that are going around, which is a whole nother can of worms of operationalizing protocol.
I really want to talk about that a little later because I'm very intrigued by what's happening with that. But I have a question for you. Can you tell us, what is, when people read about, this theater, this show has a very strict COVID protocol, what does that entail? Practically speaking, how many times a week do people get, how does it work?
Yeah. Well, there are four parts of it. The first is vaccination. So, all company members are fully vaccinated. So that makes sure that if they do get COVID, they're much less likely to have bad health outcomes. The second is really good air quality. And backstage of these Broadway theaters, many of them were, moldy and didn't have great filtration and dusty. And so not just overhauls to the HVAC systems, but also bringing in those portable air filters into dressing rooms, especially an ensemble dressing room with 8 people in it, and there's no air movement in that room. So we had to do a lot of modification of spaces. The third is masking, not just with cloth and surgical, but those high filtration KN95s, KF94s, basically at all times, unless you're on stage performing, you're applying your makeup, or you're eating or drinking. So a very strict protocol would say, like, everyone all the time needs to be wearing these in the backstage areas. And then, lastly, testing, like you said, the opportunity to identify someone before they're contagious to other people means that if you're testing frequently enough, you can detect it, pull someone out before they risk spreading it to everyone else. Mm-hmm. And that, I think, is one of the trickiest things. And as we lighten our protocols, as things get easier in the city, or now they continue to be going up again, so I would say a really strict one would probably be testing, 4 to 6 days per week with a high quality PCR test.
Wow. 4 to 6 days a week. That's pretty much almost every day they're on stage, really.
Absolutely. Yeah. Right. So that would be the most intense of the protocols, everything that I just described. And but all of those things really are dependent on 2 factors. What's the burden of COVID in the community right now, which is like the likelihood that someone's going to walk in infectious, and how many cases have we had recently within that theater? And so both changes in either one of those things can change the level of intensity of those protocols.
Mm-hmm. Right.
I'm curious, Blythe, there continue to be, as Elizabeth pointed out, instances in which companies cancel performances. What's the threshold, the difference between pulling a person out and using an understudy, which seems to be often happening, where someone tests positive, and deciding not to do the show that night? It's hard to figure out, it's hard to fathom as a theater goer what the decision-making threshold is between those 2 decisions. And how is that change from show to show?
Well, I would say newer shows versus older established shows are in very different risk profiles in terms of likelihood that they might have to cancel. Mm-hmm. So if a show has been happening for many, many years, you have so many people who have played that role before that could come in at the last minute. If the principal and then their understudy both happen to have COVID at the same time. And it doesn't even necessarily mean that they both got COVID from each other or within the theater. When it's hot in the city, you can have to cancel a show just because everyone got it from who they live with at home. But for those established shows, you may still have enough of a reserve of people who have played those roles before that even if a lot of people in the cast all are out sick at the same time, you can still go on. And so newer shows are in a much more difficult position, I think even financially, of being able to, how many understudies do you have money to fund and support? And I do a lot of, mathematical calculations of what, like you said, game theorying out, what combinations of people all having COVID at the same time would mean that the performance has to be canceled. And so the thresholds are often that puzzle.
Mm-hmm. I was curious as to, well, for instance, like it seemed to be going okay. January, February, March seems to be going okay. Late March, early April, something happens. And suddenly we have lots of shows like getting understudies up and then canceling. And April seemed that it was really kind of spinning, not out of control, but it was definitely visible to the point that it was like, I had to reschedule one show like 4 times because of...
Well, Macbeth has been, seriously hampered.
Right. And Strange Loop is the show I'm talking about. And the first preview was, I think I rescheduled like 3 or 4 times. Yeah. And at first, and it's a show where you can't really, it's a very small company. You can't really, there's only so much you can do. What happened? Wait, was this?
Yeah. Well, Macbeth and Strange Loop missed an opportunity to collaborate with my team.
Okay.
I'm going to help that.
There you go.
Oh, no. Okay. All right.
Yeah. No, but I would say, I think they were, I'll just speak generally of the trends across all the shows.
Yeah. I didn't mean to like single out a show. I meant like
no, it's okay. I'm not going to throw any specific show under the bus.
Sure.
You can do all the right things.
Right.
You can do every single thing and still be unlucky and cancel. The difference is that doing all the right things just increases your probability of success, I think, with spread of diseases like this. But December was a war zone. I mean, it was really scary. I mean, in Manhattan and, I think within all of the populations that I oversee, was handling the biggest Omicron outbreaks in our country to date at that point in time. With Broadway and retail data from New York City, my team had collected and curated the most rich data set in the world with COVID Omicron, infections. And, we were getting calls from the FDA and WHO and CDC saying, like, tell us what you're seeing on Broadway. We want to learn from what you guys are seeing. So it does seem like things hit Broadway first because of a set of those unique conditions. Like, this is one of the greatest cities in the world, but it's that urban density and migration, the tourism, that density that really creates an environment where, it's a risky place and a risky industry. But January, we saw that taper down. And now, as you said, we're in April of 2022, 3 to 4 months out. And who am I seeing infected now? Everyone who was infected in December. So in December, we had that BA.1 variant, and now we're seeing, 95 to 120 days later, people becoming infected again with BA.2. And it's not necessarily any easier physically.
Wait, you mean the same people?
The same people.
Oh, wow. Okay. That's interesting because a lot of people were taking for granted that if you were infected once, you're good. And
right. And that's
not the case. Great. Okay.
And I'm glad that I get the public health opportunity to explain that.
Okay, see, I did not even realize that. So
listeners, I think because it changes, your individual risk choices. Am I going to go do this family event, or I'm going to maybe travel out of the country next week? What am I willing to do this week or not do this week because I don't want to have COVID cancel my trip? So I think it's really important for our community, both audience members, casts, crews, to understand that we are seeing those reinfections.
Okay, can we talk a bit about like audience members now? Because I feel that so far, being in the audience, it's looked pretty good from the mask wearing standpoint. But for instance, I feel like just like in the subway, where now it feels like it's not mandatory anymore, at least people take it like that, whereas I believe it still is in the New York subway, but I've seen like less mask wearing. And I was at the Brooklyn Academy of Music last weekend, and I saw there were women 2 rows ahead of me. And as soon as the lights went down, they all took off their masks. And then they put them back on at intermission when the lights came up and they could be seen. And then as soon as the light went back down, they all took them down again. And it pissed me off to a point that I cannot even, I'm still seething. But I've been seeing that more. So from the audience point of view, like what is it like to be sitting among 400 people, 600 people, 2,000 people, and there's like 10, or 12 who are suddenly deciding that it's okay to take off your mask once the lights are down?
I'm so glad you asked. This is one of my favorite things to think about, because even last week, New York City and the league are rolling back requirements for theaters to even check for proof of vaccination. So it's a hot topic right now to think through, what do we want to require of people, both in terms of vaccination and masking? When can it be optional? And, I actually photograph and video audiences right before the shows and sometimes after the show or intermission. And I do analyses of what percentage are wearing cloth, surgical, high filtration masks, what percentage are wearing them over their face or under their nose. And I run calculations about the probability of transmission if there was an infectious person seated in different places
Oh my
within
God.
the theater. Yeah, don't worry. Somebody's up. Somebody's on the case.
Oh my God.
Wow.
Such a nerdy thing to do. I love it.
That's great.
This is what my training is in. I do these, simulations because that's how you inform public policy. What really is the ideal policy? Because we have to balance, individual choice and comfort with, with what's best for all of us together as a community. And go ahead.
So let me ask you this about that. Because I think there's a psychological aspect to this too, that I now think of my equipment for going to the theater as pad, pen, and KN95. I mean, that feels permanent to me. So the other night, I went to, I had an experience somewhat like Elizabeth's. I went to see Harmony at the Museum of Jewish Heritage, and that's the Barry Manilow musical. I sat down, and about half the audience was unmasked. This is not a Broadway theater. It's they're supposed to have a mask mandate in that space. It's a small space. I got really nervous. I didn't feel comfortable. I left. I didn't see the show. I left. I said, Val, we're leaving, and we left. I had seen Barry Manilow come off the elevator before the show, maskless, and I didn't think that much of it at the time. And the next day, he put out a statement saying that he had COVID. So I felt very vindicated in having left, and it also validated for me the idea that masks, are now a part of my uniform, but how comfortable should I be, Blythe, going to the theater? Your job right now, part of it is making sure I feel safe or as safe as I can. Where are we in this space of navigating this? And, is it all just a matter of my own comfort level at this point?
Peter, you mentioned there's a specific word in there that I think is important. Do you feel safe versus are you safe? Or what is safe enough? What is the threshold? There are always going to be risks. From my perspective, I think that, we are in a place now where, you going to the theater with your pen, your notepad, and your KN95 is safe to do. And even if there are people around you that are not wearing a mask, we know from nurses and doctors, in hospitals that this is how they protect themselves.
Great to hear.
It's really about the fit of your mask. So we just we can do some more education on how to get your KN95 or KF94 to have that good tight seal around your face. But that's really what's going to be protecting you. And once you're seated, it's really just the people that are immediately around you, that are the ones, whose breath are going to be like hanging out closer to you. And so as I'm thinking about it now, I'm also comfortable rolling back the requirement for vaccination for a couple reasons. Right now, there's no difference in the likelihood of someone being infected, whether you're vaccinated or not. Everyone's getting infected. And whether you're vaccinated or not, people are just as infectious. You're just as likely to pass it on, regardless of that vaccination status at this point. With the current strains that are circulating. And so, really, by the most effective tool to stop spread within the theaters is a high quality mask. But even if people around you are making a different choice than you, those, highly effective filtration masks are one of our best tools. A part that I always evaluate, though, because I've walked through almost every single Broadway theater now, inspecting it from top to bottom. I'm crawling around bathrooms. I mean, it's intense. But as we go to mask, move to a place where it will become optional to wear masks. I do care about those first couple rows because I want to make sure they're not putting actors at risk. Because actors are the ones who don't have a choice. They aren't wearing a mask while doing their job. So, there may come a time where masks are optional for everyone, except the first couple rows may have to wear a mask.
Interesting.
Well, okay. So, and New York is actually pretty good in the grand scheme of things compared to other places. It's pretty good about masks. So, have you heard anything? What's happening in theaters in other parts of the country where masks wearing is a lot more like a daisy call? Let's put it that way to be polite. How do they do? How do these theaters do? Like, do they have problems? Do they enforce mask wear? Like, what's happening in theaters in Arkansas or Texas or Montana? I mean, they have theaters in Utah, wherever.
Yeah,
Florida.
This is what I've really been hearing about with our touring companies. Because as they go from state to state, they are seeing that huge amount of variability throughout our country. That while there might be high mask compliance in one city, and then they move to the next city and no one is wearing masks within the theater. And it's really hard to evaluate whether or not, there are super spreading events happening because as, a researcher, to be able to answer that question, you have to test everyone before and then test everyone a few days after. We're not set up to be able to really understand what's happening in those. But that's where I think the local context matters, the local public health guidance matters. Because those local health departments are doing the best they can, making recommendations that fit the context and the acceptability and the willingness of that community to participate in local guidances. And they often reflect the variability between guidances in different regions of our country. Often reflect the variability in people's preferences in those areas. So it's difficult and my job is wanting to keep these company members safe, no matter what city they're traveling in.
How do you? That's really interesting, Blythe. It raises a question for me about how you navigate the various interest groups when you have a union like Actors Equity or the stagehands versus the producers versus the theater owners and versus regional companies. At what point, are you the moderator of all those interests and trying to get them on the same page? And is it the least resistant that you have to deal with or the most resistant to, it's an interesting problem. Where do you settle on that? And is that a changing standard based on the individual players in each organization?
Well, everything that you just described, I would encourage any listeners that if the challenge you just laid out is interesting to people, pursue a career in public policy. Because this is what it's about. It's about recognizing you have a very diverse stakeholder set that you all want to work together as a team. Every person has their own interests, represents groups that have different interests, and you want to reach a place that's a win-win-win-win-win for everyone. And to be able to do that, I have to go through a lot of mental exercises, imagining each perspective, and, trying to throw out, lots of different solutions and options and balancing from everyone's perspective. Okay, which one is actually optimal for everyone? Because if one group, is a big loser from it, then it's not going to work. But that's true, I think, in all, not just public health, but all public policy, which is why it's fun for me to be able to help that, at the White House and both administrations, really. So people should pursue government if they have that skill set.
There you go.
Do you have a sense of a timeline in terms, because we always read about I wonder how long is it going to last? Like, how long are we going to have to wear a mask at the theater? There's every once in a while there's rumors that they're going to they're going to stop the mask mandate in theaters it keeps getting pushed, but you hear that once, like first it's impossible to say anything at this point, but like, do you guys work with timelines, or is it just more at this point, like, let's get to the next month?
Yeah. Well, I mean, you're talking to one of the forecasters, so I definitely have my own predictions that have a large amount of uncertainty over time.
Absolutely.
But this isn't going to, we're at the beginning of another surge right now. This will not be the last surge. This will not be the last variant. But I do have confidence that we have all of the tools that we need to be able to manage this. I want revitalization of New York City, of our country, of businesses, of people's livelihoods and growth of jobs. We have to balance that with making sure that, we do not threaten our healthcare capacity, so that if you get in a car accident, you can go to the hospital. It's not full of COVID patients. So there is a responsibility that we have in being able to make sure that as we try to be open and productive and get people back to doing the work that they love, that we're doing it responsibly and understanding when there's a spillover impact on the community that could be harmful, and taking that seriously. So we will have to continue dealing with this. And I think the businesses that are going to be most successful, not just in theater, but this applies for producers, but it also applies for retail chains or lots of the different groups I work with. The ones that will be the most successful are the ones that are prepared, that, prepare for the worst and hope for the best, but they have a plan that will keep their doors open and their people at work and healthy.
I only pray that I have your diplomacy when I get on that flight next week, because I don't trust myself. Well, actually, I will have to, because I fear for my safety, actually. But, and I don't even refer to COVID. COVID is the least of my worry when dealing with those nuts who are flying now. But I wish I had your Zen approach to this, because I need to trust my calm on that.
But I'm very reassured.
Yes.
By hearing Blythe talk about this. I'm going to invite her to every show I go to now. I think she's going to, my wife's going to have to move over.
There's still shows I've never seen.
Yeah, there you go. But I just want to, we should let Blythe go. But I do wonder, Blythe, I have friends who constantly ask me if they should go back. I've been to 80 shows. I've been to 80 productions since we've come back, and, knock wood, everything's been fine. But what do I tell people who are either immunocompromised, older people? They want me to give them the okay to go back. Am I safe in saying, look, if you wear your KN95, if if you just go sit down and observe, if you're uncomfortable with a lot of interaction, you can reduce that. Is that what I should be, or what should we be saying to people who still have fear?
Well, I think just being respectful that every single person has to make their own assessment. They have to weigh the trade-offs themselves. But this isn't going to be, that dilemma for an immune-compromised or elderly person isn't going to go away very soon. And, people have to make, balance those trade-offs of, I do have a way to protect myself, vaccines and, wearing a high quality mask, but you have to weigh that with, am I going to stay home forever, and have a low quality of life? Or am I going to, take some amount of risk and, enjoy the time that I have?
Wow. Okay. Well, no, I think what I retain is that the level of like feeling safe. Like I have actually been fine going to the theater. I've seen not 80, but a lot of shows, and I've always felt comfortable. I have my mask on. It's got a good fit. I'm feeling okay. But a couple of friends invited me to go see like a metal show with them at a club where I knew nobody would be masked, and that I would not do. For me, that's where I drew the line. I knew I would be the only one masked in there, or one of 10 people, in a crowd of 400. And that I was not ready to do. That's the line for me right now.
Yeah, and if you guys want just a practical rule of thumb that I'm using now in terms of when do I really want to make sure people are wearing masks or not, I've always said before, outdoor things are super safe. We almost never see transmissions outdoors, but you can also use some of that intuition about the airiness of spaces when you're trying to judge comparing venues. How safe is one theater versus another theater? One just like rule of thumb I use, that if the ceilings are lower than 20 feet in the area where I am, then I take it more seriously, the likelihood that, that if someone were infectious, that's kind of air that I would be mixing with. But if it's higher than 20 feet, and I think about this in restaurants too, if there's an indoor dining, situation, and I'm trying to compare the risk of one restaurant versus another. So maybe that's a rule of thumb guide that can help other people as well.
I've been wondering about restaurants too, because for me, it's how close are the other tables? And I feel that if they're kind of far enough, I feel okay. The same way that I have been going back to the gym, and but I go at the emptiest. Yesterday, there was 2 of us on the entire floor, and that feels okay to me. 2 p.m. There's on a weekday, there's nobody there. But I think if there was 10, 12, I probably wouldn't go. But I've never seen more than 5 people at 5 p.m. and I feel there's nobody nearly remotely near me. But yeah, it's such a case by case basis.
This is where I try not to say it anymore. Peter knows my catchphrase. If you can smell my farts, then you can catch my COVID. So.
Oh, okay. Wow.
Yeah, I would love to have used that in my story. But yeah, you've heard it here, folks. That is the greatest description of how to understand how we share public space. I love that. And I have to say, Blythe, it's really, really important for the job you have and your ability to explain these things in plain language to people, because that's what we crave, understanding. And the more you know, as they say, the more comfortable you are and the more you feel like you should be out in the world. So we really appreciate your coming on today, Blythe, and talking about this. I think that this is incredibly valuable information, and for people and I hope maybe you'll come back in a couple of months if we beg you and talk a little bit more about where we are, because I think this, as you say, this comes in waves. So thank you so much for being here.
Thank you so much.
Absolutely. Thank you for having me.
Oh my God. Okay, you know what? I am feeling so much better now. I've got to say, I try to be a half glass full kind of person, and my glass is a little bit more like maybe 2/3 full now.
Yeah, knowledge is power. You feel more centered in what you're doing when you know the parameters of what the scope of the problem is. It felt manageable after talking to her.
Yes, I'm definitely feeling more settled. I mean, you know me. Am I a hysterical person? No, absolutely. Yes. I am.
Yes.
Yes.
You are.
So.
Yeah.
Okay. All this talk, this really made me think of a show that we were talking about delays and various problems happening to shows. Yeah. And one show was really hit hard. And I think it's a show we both saw. It was one of the public's big shows this spring. And it was Suffs by Shannon Taub, who actually...
The Public Theater.
At the Public Theater, yeah, I'm sorry. And she actually had to miss her own opening night because of COVID. That show was hit very hard. And I wish I had liked it more. I don't want this is like double. What is it? Like double indemnity? She missed her opening night, and then Elizabeth Finchantelli didn't like the show.
Yeah. Yeah, it didn't get great reviews. We should just say it was a very highly anticipated piece. It's a musical, a sung-through musical about the suffragist movement of the early 1900s, and it centers on a character that Shana Taub, the composer lyricist of the show, plays, which is Alice Paul, a kind of antagonistic driven member of the movement who was sort of her Alexander Hamilton, if you would.
Yes.
Shana Taub sort of models that character on, I would say loosely, on the kind of trajectory of Hamilton, being somebody who is a rabble-rouser who doesn't mind pissing people off.
Yes. I actually, I'm trying to put this nicely, but I think that was one of my issues. I have a lot of issues with the show, but one of them is that I am not sure that Shana Taub should have played that character herself. I don't think that did a service to the character. Alice Paul was, by all accounts, not a super nice person, and that, of course, creates it's a good thing to think about, because can someone who's driven and has this like Messiah fervor, who's like has the intensity of a cult leader that she uses for good to try to get women's suffrage, but she's not a quote unquote likable protagonist. And I feel the show would have been better with an actress who could summon that quality of someone who is completely possessed by her cause. And I never got that from the performance, regardless of the songs or all that. But just strictly from the performance standpoint, I never got that from Shana Taub. I don't think acting is her strong point. And it might have been better, it might have served her own show better to delegate that particular part of it. I mean, she was fine, but...
Yeah, I think that's a fair comment. And I think also we should say that the entire cast of 19 or 20 performers are female and non-binary. That's sort of one of the conceits of the show. And there were some very powerful performers in that piece. Nikki James, Philippa Sue, Jen Colella, any one of whom I think would have been a more magnetic figure. It really isn't. You need a kind of like a radiation coming out of this character that compels you to follow her journey.
Because she was I'm sorry.
That didn't happen. That was what was. I think that's lacking, and that's just a real flaw.
I also thought that the show was trying to do so much and trying to be everything to everybody by covering everything in a way that I felt completely compromised the dramatic aspect of it, where after a while, I just didn't feel that involved. And we're talking about a show in which some of the characters are force-fed in prison. This is a very powerful scene, which actually is not powerful, which is why it's so weird.
It's got a lot of... we should say, I think that Shana Taub is incredibly talented. She's writing a musical with Elton John at the moment, and she also has done in Central Park, musicalized versions of Shakespeare that have been really, really good and fun. There have been several of them that are wonderful, and I also thought that this piece would have been stronger with less recitative. There was a lot of dialogue set to music that sounds, almost sing-songy and becomes dreary. And that's a real problem.
She had done a 12th Night and As You Like It with Public Works with Shakespeare in the Park.
Excellent. But I do think that it would, the everything shouldn't be Hamilton, but the template of a kind of Broadwayization of Hamilton, even in hip hop, really, comes through. I thought this one sort of was shy of personality in general. The songs didn't really reveal who these people were. They tended to be statements of position or, historical, exposition. And that, that just only goes so far, outside a classroom.
Yeah, I fully agree. It just tried to cover so much with so many characters. I felt very emotionally disengaged from it.
Now, the flip side of that, Elizabeth, was, for me, the transformation of Cyrano de Bergerac at Brooklyn Academy of Music with James McAvoy as Cyrano in a hip-hop beatbox version of Cyrano, a play I really don't like.
Oh, okay.
At all, and as a native Française, I imagine that's heresy to you.
Well,
Rostand must be a hero to you, Elizabeth.
Not particularly. It's not my favorite play either.
Oh, good.
No. I'm not. I mean, I don't have strong. I've got to admit, I don't have strong feelings about the play either way. But it's interesting. This show. Okay, this show we have to say in context that it's been getting rave reviews, great reviews here. And when I saw it, I thought, okay, this is good. But I wasn't loving it. I was not really involved. And I found myself thinking about it, actually. Like, why was it not working for me? And I've been thinking about it a lot more than shows that I actually loved when I saw them. And I think Helen Shaw, actually, the critic for New York Magazine, she was putting some emphasis on... So James McAvoy really bulked up for the part, apparently. Like, he really... He's very, very in shape. Let's say. And
buff. I called him buff and blazing.
He's buff and blazing. And Helen was really talking about that as like it was such a big thing he did for the part. And I could not understand why she thought that was so important. Because part of it for me is, of course, the character of Cyrano in the original, his problem is that he's a wit with a huge nose. So he compensates for that huge nose that he's mocked for and bullied for by being wittier and smarter than everybody around him, and also a great soldier. So I was really kind of struck, of course, that James McAvoy does not wear any prosthetic nose. He's just as he is, and he's very handsome. And of course, we have to use our theatrical imagination and fill in the blank and add the nose in our head and imagine him as someone with not this great physique, which is fine. I'm all in favor of that. But it felt...
Are you handsome shaming him?
I am handsome shaming him. But for me, it also felt like, you know, when those beautiful actresses put on a fat suit? And that bugged me. That bugged me. That aspect of it bugged me. It was like...
What is it that bugged you? That he was good looking?
Yes, because handsome guys already get all the roles, and now they have to get the roles of the guys who are not really handsome. This is there anything you guys don't want? But I kept thinking about that thing. But I kept thinking about that thing about him bulking up. And you could see him as overcompensating. The character is overcompensating. It's really a play about this crazy... unhinged masculinity and how this is masculinity under attack. And I think that's what Helen was getting at with this remark about him bulking up. And I've been thinking about that. But then there's things in that production that I have no idea. Why does Cyrano kisses Christian, the guy that he's pretending that he's acting as spokesperson for, in the second act? What did you make of that? I have no idea what that was trying to accomplish.
I think there's a linkage of identity that's going on in that piece. They really do consume each other in one way or another. They become each other as far as that can happen. And I think that, as I recall, it's Christian who initiates the kiss, isn't it? Isn't he the one that sort of?
I don't remember actually. That's a good question.
In my memory, that's what happens, and I think he's the more confused personality in general in the show. And generally speaking, Christian to me has never been a particularly interesting character. And I think it, if nothing else, it makes him a more interesting character to make him sexually ambivalent. So I went with it. I didn't feel like I needed a thorough justification for that moment. It didn't feel like the strongest moment in the piece, but also, as you say, it's very, very male. This, the story itself, but there's so much masculinity going on, and I also felt that there was a separation between the kind of masculinity that McAvoy represented and the cadets were, were all like younger. In some ways, seemed athletic in a different context than McAvoy, who was, and I thought isolating him was okay psychologically. I could make the leap that he wouldn't be desirable to Roxanne, that Roxanne was not attracted to him, and that was enough for me. It didn't have to be that he was so hideous that nobody would ever think he was, good looking. That was the reason that he couldn't get Roxanne to love him. She just wasn't, attracted to him.
Right.
That wasn't, she just didn't. And I think that's what they went with. Now, the last thing, I find it all so hokey, that play usually, and so sentimental. And the idea of that it's physical, it's just the physical attraction, he's so ugly or he's so hideous that, he's got to only woo with words. It feels like such a stodgy convention. I mean, maybe I've just seen the play too many times. So I was relieved that we didn't have to deal with the nose and and that it was all just sort of it was not a dagger of the mind, but a nose of a proboscis of the mind. You know what I mean? That was fine with me.
I'm fine with that in theory. And then I realized I was more attached. I feel like I needed something.
Right, that's fair. I think that's fair. I don't discount that.
But that is,
at all.
I keep thinking about. I thought Evelyn Miller was a great Roxanne, like one of the fantastic. It was just such a novel take on the character. I love that.
Totally.
I'm not entirely convinced that the poor Roxanne at the end ends her days in a coffee shop. What a tragic fate. I don't get it. I mean, that's, of course, that's where I'm going to end my days. So drinking, gallons of coffee.
Well, we could, I hope people out there are, this is a really bad transition. I hope people out there are enjoying their coffee as we finish up this podcast
This is the worst
edition.
transition ever.
Yeah,
oh
thank
my God,
you.
It's so
thank
bad.
you for that.
I'm going to try to top it next time. This is terrible.
Yeah, exactly. I'm just trying, this is totally meta. Folks, I'm trying to get us out of this episode so you can get on with your lives or finish your car ride or however you're listening to this. But I think this was really a great meetup for us with Blythe, and I hope we're going to try and bring you more guests of that caliber coming up in upcoming episodes.
Only the finest.
And we hope you'll stay with us for the next edition of Marx and Vincentelli. Until then, I'm Peter Marx.
And I'm Elizabeth Vincentelli.
Thank you for listening.